Thank you so much for joining us. Would love to just start with talking about your own journey, right? Like how you began, what your journey in healthcare has been, what all roles you've kind of gone through.
So my mom was a nurse and she brought us here to the US about, when we were teenagers. And so when she encouraged us to go, for me to go back into nursing school, I wanted to be in business, but she was like, healthcare always has its great points and, you're always going to have a job. And if you wanted to do something different, you always can do it. So I started off going to nursing school and, she was right. When I went in and started working, I realized the beauty of the healthcare and how much patients can impact you. I learned a lot from my patients as a person who, it teaches you to be more empathetic, compassionate, and creates a better worldview when you are creating and forming relationships in your care. It creates a sense of greater responsibility. And so started off as a critical care nurse in the open heart unit and then moved up to be a charge nurse. Then along the way, met my husband, had kids, kind of pulled away, but I would say the most poignant moment in my healthcare, it came outside of healthcare. So I got an opportunity to be in a business, a silent partner, because I had 3 little kids and, I just wanted to invest my money in something, not fully be immersive in it. So on opening day, I found out all my investors pulled out and then I ended up holding the bag. So I had to learn everything from scratch about the coffee business. So we served fresh roasted coffee, espresso, and signature drinks. I ran it for about 5 years, and then because of increasing costs, I kind of had to make a decision to pull away. That very same month, I turned around and enrolled myself in my doctorate for healthcare administration. There were times I couldn't make payroll, and so it was very heart-wrenching, all of that, the resilience, the perseverance, the business mindset. And I started off back as a manager of my hospital. Also learning about the healthcare landscape through my doctoral journey helped me expand my worldview. So it wasn't just about managing my unit, but how could I, as a leader, make an impact on healthcare in general, right? And then I moved into being the CNO of 2 other hospital systems. And now I'm looking for my next role, which is my CEO, something that I've always wanted since the inception of this journey. It's about the impact that you can make in transforming and creating better healthcare systems for our patients.
So, Neena, you've seen healthcare over decades, but how have you seen like the movement from a pure reactive, curative kind of healthcare to moving more towards preventive health?
So in the past, because you're working in the system and the system then rewards providers, clinicians for illness treatments. And that used to be the healthcare system financially still reimburses based on illnesses. So everything is rewarded based on the amount of procedures or how you treat sick people. But we are in a system, and as you can see, the system cannot maintain itself that way, right? The WHO definition of health and wellness is not just the absence of disease, but an entire physical, social, spiritual. And so when you started to learn about all of the other factors that contribute to health and wellness, which is your social determinants of health, your zip code, where you live, the food that you eat, the lack of access to healthcare, equity in healthcare, lack of equity and diversity in healthcare, and how do you manage all of that? We've seen that all of it has created negative outcomes for our patients because we as a healthcare US system spend the most on healthcare compared to all Western nations, but we have the poorest outcomes because the system is fragmented. You have providers, clinicians, different types of providers, different types of healthcare entities, and they don't talk to each other. The care coordination is fragmented. So when a patient comes to a system, patient itself is lost, right? They might go to a doctor for one problem, but then they have to go to another physician for another problem. And then sometimes the two don't talk, right? EMR came about, right? And when the Affordable Care Act came about to solve this issue about integrating and having to speak through the electronic medical records, making it more easier. I started off in the paper charting system. We've evolved through all of that. Because when you look at all the reports and research that's out there, we have problems with safety, quality. We have high maternal mortality rates, infant mortality rates, So chronic diseases at our all-time high. Americans are living longer, and so you have chronic diseases, but we're not still able to manage lifestyle. There's more emphasis now on prevention of care, where the reimbursements have been structured to do well visits, or maybe the healthcare insurance systems are also seeing the value of, if I keep my employees healthy, I get a better rate of being negotiated with as employers with my health plans, and so I can keep my population. But these are all siloed effects, right? So a lack of a complete infrastructure investments on public health is not there, right? It's where it takes healthcare policy workers and a real effort on everybody to make sure that we are doing a better job. And that's something that it's a mindset shift that needs to happen. There was a big impetus in the last 2 decades on focus on population health, and a lot of health systems kind of took that on, right? And they created that population health mentality, medical homes, things like that, right? So now there's a lot of clinics that are out in the community that we didn't see that before. And the proliferation of such health, right? Now we have Walgreens, CVS, and Walmart's delivering care. So that didn't used to exist before. So people can go into their Walmart and see if they can get their blood pressure checked or things like that. So healthcare is evolving, but I think, there's a lot more work to be done. And that's why we're here, right? We're in it, invested our knowledge, and we need to kind of contribute to making it better, not worse.
You mentioned you were doing paper charts and then you've seen the EHRs, the EMRs being implemented. We are now in a very interesting time where AI seems to be the next thing, right? And I know healthcare is generally slower to adopt, but this time it seems to be a little different. Where do you see kind of AI playing a role as you go forward?
Actually, it's funny because I'm learning more about AI, and so I enrolled in a course through Harvard Medicine in AI for healthcare executives. It's opened my eyes, right? So as a healthcare leader, it is incumbent upon us, whenever something is changing or can transform health, you need to have knowledge. But it's also about knowing what's in the healthcare horizon and how it can change the landscape. We have a lot of technologies, and it has to be a right adoption of these technologies, right? So artificial intelligence started in the 1950s. It's not till the recent few years that it's really exploded, especially in the field of image curation, in radiology spaces, in ophthalmology spaces, dermatology spaces. It's really going into really in a sphere of where it's being really looking at all of these data mining and realizing it. We were creating AI systems in the background. When Moderna created its mRNA, overnight you had a vaccine. It's because they had an AI platform to do that.
Yep.
AI really now looking and creating antibiotics, right? Shortening the time of research and data and analysis of data. And so where the beauty of AI stands in its adoption is looking at how we can create better efficient systems. What are some of the administrative tasks that my team does that takes a lot of time, whether it's forms and filling forms and billing, in claims. There's a lot of these areas that are very ripe for adoption of AI.
I've also always thought about AI as something that is going to be a force multiplier. It's not going to replace doctors or replace nurses. Of course not. Healthcare is very human. It will always need these professionals, but it's about what can it do to sort of improve your efficiency.
And we often abstracting data mining is a big issue for us, right? Lack of data, making data-driven decisions, right? And when we are executives, making decisions that are not based on just experience, but also based on information that systems can derive and give us in a timely manner, helps with the decisions that we're making and what we need to do, right? Where we can see is how can we remove some of the administrative burden? Is there an AI assistant that can help in scribing up notes and putting clinical notes together that a clinician can review and then put it through together. But there needs to be oversight. And as we're seeing the negative effects of ChatGPT and not being monitored, so we need to be cognizant as leaders. Yes, the AI is not the next great best thing, but how as leaders we have an ethical use of AI to build clinical judgment. We want to make sure that whatever we are delivering, that it's being delivered in a safe, efficacious, with quality, and with some human oversight. In the end of the day, you can't replace empathy, compassion with AI systems, right?
You could be a little skeptical about it. You could be more optimistic about it. That's your perspective and how you kind of perceive it. But there's also all the stuff that's happening from a policy perspective, right? I mean, somewhere funding is increasing, somewhere fundings are drying up. From a policy overview side, like where do you see that going?
Yeah, I think this year has been particularly challenging for a lot of healthcare personnel, how these policy shifts are going to affect the bottom line and how we're going to be managing to deliver care like we used to, right? So part of this is when you have defunding of the Medicaid systems and when a large population just depends on Medicaid funding from the federal government, how is that going to shift? Is that going to shift to the states? And if the states are not going to carry it, when these people are dropped, what and then happens to them, right? Are they then going to get more sicker? They're going to come to the ER. So that there's a lot of downstream effects of how policy impacts now. So there's a funding cut, but there's also opportunities here, right? And I think part of this is try and bring not only just people within the healthcare system, but outside of the industry, right? Food banks, things like that, community areas where we can all look at other opportunities. At the end of the day, it's about creating access and also creating for patients to come into a healthcare system and get the care that they need, not like illness care, but also preventive care, and keep themselves healthy.
You've had like 2 decades of experience. You've literally
over
risen
2
through the
decades.
ranks. You've gone through all of it, right? You would just love to kind of get your perspective in terms of the bureaucracy, the layers, the opportunity to grow.
It's interesting, definitely challenging, but at the same time, rise as Asian or minority women leaders through the ranks doesn't come with its own challenges, and so it's about persevering, and so as a woman leader who wanted to rise and has ambitions and wants to persevere, it didn't come without its challenges, because you're always going to be looked as that you don't belong there. I went to a CNO conference and I walked into the boardroom and there were a sea of white women and I was the only brown person there. The first instinct for that person who was greeting me was to take me to a back seat where all the people who were scribing were there, and so I sat there for a while, and I sat there thinking that I had this imposter syndrome. Do I really belong here? I was having this internal struggle in my head. If I need to, rise above it all, right, and then pick myself up, and then take myself out of that seat, not because it was an ego issue. But if I did not stand up for myself, there's always be spaces and places where I felt like I didn't truly belong, and that wouldn't be beneficial for me, for my confidence, for my growth as a leader. So I had to really own who I was, and take a seat and go sit at that chair. And so in spaces where people look at you as you're not there, and then when you're looking at a different view, I always had this mentality of, always as a woman leader, you've got to work twice as hard, And my daughters keep saying, how many more letters do you need behind your name? It's a way of validating and truly, also maybe a self-insecurity that like I need to establish who I am, and showing that these credentials prove myself, right? I'm now applying for CEO positions or COO positions. I had a lot of mentors and coaches and sponsors who would say, unfortunately, that is the landscape of healthcare. They may not have the level of degrees but they have potential, yet women, and especially brown women, have to prove themselves in that job. And so for me, it's all about creating resilience, never giving up, and also claiming that chair at the table. But it's also a responsibility to the future, right, for my children and for women that are coming up in this country. So you need all of these people who can then help you move up. And of course, your inner spirituality and your faith, it's also a big driver. But for that perseverance to happen, right? And so it all has to come together.